Hi everybody. Today I'm gonna tell you that how to use electronic file effectively. So for that, when the patient enters in the clinic in the primary healthcare system, they enter their name through the reception by their civil IDs, and when they enter their name from the reception and comes to the clinic, so their data, everything will appear in our primary care information system. So when we will go through the icon of the doctor and the diabetic icon, we have a two. So when we'll go to the doctor icon, we will find the general clinic. So here, when we press the waiting patient, we will find that the patient have the visit serial, that is 35 showing on the screen. So we have to take this patient first. That is our first thing what we have to do to take the patient, right? After taking the patient, when we'll see, there is all data of the patient appears in the system, the name of the patient and age and gender and from which area he or she belongs to with their civil ID. So what's our aim? What's our aim to do first? That will be a best option that we should go the patient visit data wise. When we'll click the visit data wise, we will find that when the patient have visited last time to clinic. So here is the patient data wise clinic. So like this patient have multiple visits in the hospitals in 23rd of the September, and also the same day he came again to the E clinic like that. So by that we will at least know that what is the patient complaints and why the patient visited to the clinic, and we have to look after that. So there are certain things we have to keep in mind, that either patient have visited recently or not, he has a chronic problem or not, so we have to go through that. Like this patient, he came to our clinic E, so we have write down his complaint and the diagnosis and regarding their measurements and signs and the prescription what we have given, and in the notes that particularly if we will note it, it should be shown here in notes. So when we'll go back, now our aim starts from here, that when the patient comes to our clinic, now patient is with us, so when we will start to ask the history, we have to write at least the complaint of the patient, whatever he has or she has. Like many complaints we have here, so written, and sometimes they have some symptoms, it's not appear in the complaint here that we have already. So what we have to do, we have to go through the other symptoms and we have to write in details that what the other symptoms he has or she has. At least we have to write it in the system. And after that, when we'll see the patient, on examining the patient, definitely we will have any sign. If you don't have any sign, at least we have to write it the normal findings, whatever the normal finding, normal abdominal finding, normal chest. If the patient is asthmatic, it's written over there, and you didn't find anything, you have to write the normal chest like that. Or the asthmatic patient is coming to us, we have to write if there is any wheezy chest like that. So at least we have to write its signs. And we are checking the temperature, so we have to put it the temperature, blood pressure, pulse, and when we will put it all the data here and we will click it, it will appear above like that. I'm writing the blood pressure of the patient. If I will press it add to sign, it will appear here. This is the science, all about the science. At least we have to do like that when examining the patient, after examining the patient. So now the diagnosis. What is your diagnosis after complaining of the patient? If he or she having the problem, like this patient, he had complaint of polyuria. So what complaint I have written here? The polyuria, and I took the blood pressure of this patient and everything. After that I wrote the signs, other signs, like the patient's blood sugar was this and that, and the patient was labeled as a diabetic, like that. And then we have to go to the management plan. So when you will press the management, you will find this column. It's a data flow chart. When you look at here, it's a diabetes, hypertension, hyperlipidemia flow chart. So like this patient came to me, and I have seen this patient, that patient having the complaint of polyuria. The blood pressure was this, fasting blood sugar was that. He did his HbA1c level, we have written here. You can write it anytime, but after saving the patient, when the patient will be a chronic, you can't write it here. It should be write it on the same day when the patient visits to us. So the weight of the patient, BMI, the cholesterol, the investigation, at least we have to write it once every 6 months or 3 months. And then what we have given, it indicate the medication and the plan of management, I mean. So when we will see, when we'll double click on that, we will find that patient has complaint of polyuria. He did his labs before 10 days and found high blood sugar levels. It was like 16.9, and HbA1c, and cholesterol was high, triglyceride was high. And when patient was asked about the drug history, he found that he was taking the antipsychotic medicine, and he was found immediately. It's an example I'm giving you for today to make sure that we have to follow these things properly. So we have to write in the notes. Notes will appear here in the plan follow. And down here we will find that annual visits, at least we have to do the, for diabetic patient, the fundus exam every year, neurological examinations, and the sodium, potassium, urea, creatinine, and these are the lab investigation. We have to write it at least 3 to 6 months. That's about the diabetic, hypertension, hyperlipidemic flow chart. So when we go back, we will find the drugs, what we are going to do, that we are managing the patient by giving the drugs. So if you will press it to the previous prescription, we will find the drugs that we have given to the patient. Like here it appears, Crestor and glucophage was given to the patient on 23rd when he came to us, and the last issuing of the medication was this. So this is very important, because we know that this patient came to us and he has already taken the medicine on 23rd of September. If he will come after 1 week, at least by pressing this icon, I will find it that this patient has already taken the medication. So we have to be careful to giving the medication on the next visit after 7 days. At least there should be a gap of 1 month. So this is all about the management. And after that, when we will go, the other icon, it's an investigation. It indicates the lab investigation, what we are going to do, biochemistry and hematology. All of us, we know very well how to print it and how to deal with that. And this is the same like an X-ray and prescription. There is a nursing details. It will be advisable and it will be wise that we have to write the nursing description. At least if we are asking for the injection, like neurobion injection is there, so we have to write it the neurobion at least for how many days you want to give, and every alternate day or not. And you have to write it some details of the nursing, and when the nurses will open their primary healthcare system, they will find our instruction that we are giving to them, and when they will save it, their remarks will appear here. It will, when we will check it, they will write it done or not done, or whatever they have written, it will appear on remarks from the nurses here. Like I'm writing, it should be given IM for 5 days, on every alternate days, like that. So after that we have the referral. We have to write it the hospital name, where we are referring the patient, any section, and I think we all of know about that very well. But here I will suggest that we have to at least rewrite with the typing some reasons why we are referring this patient, and there should be a particular reason for that. If we will write it by typing, it will be a great. So then after that we have a non-communicable disease icon. When we will press it, there are many non-communicable diseases that will appear here, like as I told you, the hypertension, diabetes and hyperlipidemia flow chart. And here it's all about the bronchial asthma chart. It's an excellent chart given by MOH. When we'll press it, if the patient will be asthmatic, it will appear here, and it will give us the guidance that the patient has a mild, moderate or severe asthma, or severe life-threatening asthma. According to that, you will find it what treatment you have to give. You will find it in here. And if the patient is obese, you have to at least go in that, and vitamin D chart, hypothyroid chart. If the patient is hypothyroid, we will find it here. Like I can give you an example of that was the hypothyroid patient. She was having 26th of August, she came into the fatigue and tiredness and the blood pressure, whatever it was, and the things has been done, and we will show by a hypothyroid chart here the details of the patients. And these are the osteoporosis and hematuria, colonic cancer and the prostate cancer chart for the screening. If the patient's is old age, we have to go through that also. And the most important thing, that at least we have to write some management plan for the patient who is coming to us in the chronic clinic. What was the previous plan and what we are going to do now? At least we have to write it in the notes. We have to write in the notes, like I saw you that the patient came to us and we have making plan that patient was complaining of that, and now we have referred this patient. Our next step is we have to write in the notes. It will be excellent. And then the other thing that is important, that we have to follow the below icons, like these icons. How to follow that, I'm going to tell you that. As we have this patient, if we'll go into the details, here you will find the summary icon. When you will take the patient, and you will find everything here, their data, everything, complaints, and you have written the signs and everything. So if the patient is coming to us first time in the clinic, we have to go through the summary. It's very important that we can find something previously by taking the history. Like this patient, when he came to me, I have taken the social history, that either he is married or not, and how many children he has, what is his job. If time allows, you have to go through that. You will find some important data about the patient, and it will help in the diagnosis and your plan of management. So there was no any medical history before, but the patient was hyperlipidemic and diabetic mellitus. It was recently found. There was no any previous medical history, so that's why we have written here the no. There was a strong family history of the diabetes, so we went through that, and after that patient did an appendectomy. Sometime you will find some important things regarding the taking detailed history. Just you have to take did you have any history of operation before, yes or no. Either he's taking. So here is an important thing I want to discuss with you. The patient, when he was a newly diagnosed and came to us, just by asking the current medication what you are taking, he told that he's taking an antidepressant, not antidepressant, antipsychotic as well. So he was on clonazepam. So after that, when we find it that he's taking since 3 years the antipsychotic medicine, it could be a reason that he has hyperlipidemia, hyperglycemia, and hypertriglyceridemia. So these was the symptoms. And the smoking details, when I asked him, there was a current, he was smoker, and he was taking since 10 years the 40 cigarettes per day. He was not motivated at all. I convinced a lot. So this is all about the summary that we have to at least taken by a patient in the chronic clinic once. So here is an allergic chart that which patient have allergy from which medicine, or either allergy to food or any eczema or whatever he has or she has. And the other icon, we have the chronic disease. When the patient comes to us in the chronic clinic, at least we have to write what problem he has, like he was in hyperlipidemic and diabetic. On the same day he came on 23rd and 24th. He was following to our clinic, either it is a government clinic, private or military or whatever, and the location which clinic he is following, that will be a good for the following the patient, that where he is following. From here, this icon, if we will write it and he will go to the other clinic, he will either we will work in any other part of the Kuwait, it will appear that the patient is following this clinic and he's taking this treatment, and the investigation was done on that day by visiting data-wise icon. So this was briefly all about the usage of the electronic file, although there are many more things we have to discuss, but next video I will upload more in details regarding the diabetic file, how do we give the appointments, and there is a suicidal risk management, because I took the suicidal risk management history from this patient. Why? Because when he given me a history of antipsychotic medication, so I went through that. There was his score was 3. So just we have to take that, either male or female, just we have to go through that immediately and rapidly, and here it will be appear the score. So this is all about how to use electronic file effectively. Thank you so much, and we will discuss in details in